8,000 people to look at it.
Great.
All right, great. All right, great. Hey, Dental Nachos crew, it's Paul, Dr. Nacho, and one of my favorite things to do during this really weird time on earth where dentistry is grounded like me as a child is to bring you interesting ideas, interesting topics. I think one of the most important things to talk about during this coronavirus challenge is how is it affecting dental students? And I have the awesome dental student, Laura Ye, here with me. Laura, tell us about where you are in the dental circle of life, your dental school experience, where you're sitting now, and how the coronavirus, just to start, has changed your normal day to day.
Well, I'm currently sitting in San Francisco in my apartment. And yeah, so we've been, with the whole coronavirus thing, we've definitely, I should probably introduce myself first before we jump in.
Tell us, yeah.
So I'm a D2 at University of the Pacific in Dugoni School of Dentistry in San Francisco. And we have a 3-year program. So I have a year and just like a little bit more left before graduation and having to find a job and all the hard stuff starts. But yeah, so it's been pretty great. And right now we're in our 4th quarter of 2nd year. So it's actually supposed to be more clinical things. Like we're supposed to be seeing more of our patients and less of class since we're transitioning into 3rd year. But with the whole COVID-19 thing, we're actually transitioning just all online classes. They're trying their best with like radiology. We have just more seminars together. So we just spend more time identifying radiographs, for example, rather than actually taking the radiographs on patients. And then, classes just as normal, but online, which is kind of weird. And we had like 2 exams this morning. So it's been quite interesting.
Now, I mean, I always think something's better than nothing, which is true, but we've had this abrupt stop to our life. I'm a practice owner in 2 practices. They are closed except for extreme emergencies. So tell us first, what's happening with the clinic aspect, maybe those 3rd years who are about to finish, or, you getting a clinic. What is the clinic totally closed, and what's happening with some of their requirements? Maybe you're friends with some people finishing. Share with us what they're going through.
Yeah, definitely. So right now our clinic is completely closed except for emergency. So we have like a few faculty who are there just to for the super emergency visits for patients who are of record. So we can't accept any new patients like we usually do. For the 3rd years, they definitely lowered the graduation requirement like crazy. Yeah. They released actually a huge list of all the new requirements for the class of 2020. And they definitely lowered a lot of them, so we can graduate a lot of them so they can move on to whatever their plans are. But they also have some OSCEs that they have planned with mannequins. So we usually have a huge clinic floor, but they've actually filled the clinic floor with mannequins. That's what I've heard. Nobody really knows because nobody's seen inside. But we've heard that they filled the clinic floor with mannequins so that they can do more OSCEs. And then, so the plan is basically to have hopefully more opening hours, so more night clinics or maybe weekend clinics, just to see if we have more time to squeeze in all those patients. But nothing's really set in stone yet, so we don't really know exactly what's going on.
Yeah, I mean, we are in this.
If they think that's creepy, they should see our sim lab floor because that's real creepy.
Suspended animation of Earth and time in dental schools. What I see as getting back to life is 2 phases, especially with dentistry. One is, can everyone congregate in a dental facility, whether that's a dental school, whether that's my private practice? You've been to the dentist. I'm sure you know dentists. Most dental offices are small. They're meant to be.
Definitely.
So how many people are allowed to be in there? And then after that, how do we start doing the work in there? In California, I just did one of my emails today, and I put in all these different links. And the most popular one was, I said, find out how long your state is grounded till, like you're a teenager. And New Jersey and PA, it's indefinite, which was always bad. When my parents were like, you're grounded indefinitely. So at California, where are you guys with moving forward with being able to do regular stuff? Is there a date in mind, or is it still indefinite?
Right now the date is May 17th, which I know, but the thing is, every single time that they come up with a new date, we're like, yes, this is going to be the final date, they're not going to push this one anymore. And then they push it. So I have high hopes for the May 17th date, just because based off of the numbers and the curve, it seems like it'll be okay by then. But I know that dentists are at such a high risk because with the hand pieces and with just everything. We aerosolize all of these particles. I was actually listening to a podcast and it said that like they had 13 people in Italy who were doing, I think, an oral surgery procedure, and they had full PPE, like with an N95 mask, like fully covered and all that stuff. It was a coronavirus positive patient, and they thought they're okay because they had all of this PPE. But at the end of the procedure, because they did use drills, all 13 people did contract COVID-19.
And I think what we have to do, and dentists, I've been a dentist for you're a baby age dentist in training, so I have all these classifications. So a bad is 0 to 2 years out of school. I'm a mad medium age dentist. I think we have to be comfortable not knowing and sharing stories. Dentists want to know about studies and science, but we're living inside of this movie. So on Dental Nachos, which I know you're not familiar with yet, but it's 23,000 people sharing a lot of highly emotional stuff. It gets, as people say, cray cray, because people say, that's not true. That is true. And what I try to do is I say, we have a platform right now where we should take in all stories, and we can discard them later. Someone says, hey, it cannot be transmitted through aerosol, only droplet, or it can be transmitted if you use a Cavitron, but maybe not if you use hand scaling. These are the things that we really need to find out and be open-minded to. I think, unfortunately, people don't like bad news in general. So sometimes before they say, oh, I don't want to know about it. And I'm in this state right now where I'm open to learning, because I have 2 dental practices, 20 team members, thousands of patients, and I'm trying to figure out the best way to get us moving forward. And some of the things they've talked about in private practice, and this may fit, you're in San Francisco, I'm in Philadelphia, but my practices are in the suburbs. So I was making a joke this morning where, like, now they say, tell your patients to wait in their car and go out and take their temperature with a forehead thermometer. So I said, I'm going to, who's going to go out there and ask your patient Millie to stick her head out the window and be like, do you have a fever? That's a system that's really challenging. And I think we just have to sit with this and be like, let's find out more. So what you said there, it is important. So tell us a little bit, I really love helping dentists at any age or stage. What are concerns that you have, and maybe the representative of concerns your friends have, whether it's missing out on clinic time, not learning enough, the future of dentistry. Share with us some things that you and your friends have been talking about. Maybe there's some ways our Dental Nachos world can help you.
It's definitely, I think, just losing out on clinic time, because obviously, like, all these online classes make it so that we aren't really missing out on the classes in general. But because this quarter was actually, so for example, the first years transitioning to second years, I know a lot of my first year friends are really worried because this quarter was supposed to be the quarter where they talk a lot about these clinical transitions. So they have more of these classes, like these hands-on rotations that you go through that show you how to work in clinic, but they don't really get that anymore just because we can't really be in clinic right now. So they're definitely worried about missing out on how to just like figure out our system, like our Axiom system, how to like, because they also teach like dental photography or just endodontics, like we do endo on teeth and all that stuff. So it's just really difficult.
I think one of the things that I see is, and you can share this with your friends and maybe they can do it on their own or the school, a couple things is, front load all this learning that you can do remotely, whether it's in school or things like patient communication, listening to podcasts and figuring this out. So it's almost like doing all these exercises while you're stuck at home. So then when you're not stuck at home, you can focus just on that. I think those are some good suggestions for your schools too. Where maybe they get this out of the way where you have double the amount of clinic time. And one of the things that I thought of that I think dental schools are really going to need to do is to lower the price of the treatment so more patients will come in so that they can get that experience, maybe even make it free. I see here my dentist cousin, Mitchell Rubenstein, he's an early SAD. He has a great course tomorrow night that we're offering at no charge to dental students. We can share that in the comments on Instagram with you. How to incorporate technology to make your life easier. Those are things that you can learn remotely at home. And then when you go back into this world and you're learning these things, you can say, I'm not going to focus on my remote stuff. I'm going to do my in-person stuff. Where are the schools? This is a big question too. Have they talked about giving you guys any refunds or credits for stuff you're missing?
We brought it up and they basically said no, which I kind of understand because everyone is working still and everyone is still, like, all the faculties are giving online classes and they're definitely working hard. And if we do have to extend into summer, they said that we wouldn't have to pay anymore, so I guess that's nice. Um, yeah, so basically there's no decrease in price, which is kind of sad, but I get it.
I mean, what I think is, see, sometimes at Dental Nachos, we talk about helping people do their jobs. And, sometimes,
Mhm.
especially with customer service, and one of the things I've been reached out to by a lot of dental students who said, D3s, we're not going to get any money back. I think the value has to be transferred some way. So whether it's a credit towards tuition or, like they said, making it up, but they have to be able to make it up so that you get the same value you would have gotten.
Oh
And
yeah.
everyone has to share in this pain, not just the
Yeah.
students. So if the students take out $500,000 and they don't get that value, that they have to get that value repaid, whether it's with a credit or with what they had talked about. I think, that's
Mhm.
where your class presidents and stuff like that can be. We talk about being kindly annoying people into good decisions, because I've seen a lot of companies, okay, at first, some dental companies, some non-dental companies say, we're not giving any refunds or credit. And it was a terrible PR move. And now they say,
Uh-huh.
okay, we're going to give refunds or credit. So that's an important one. I'm going to check our Q&A here for a second, see what people are asking for us here. Someone asked here, there's going to be many changes in the dental world as we come out of COVID-19. You're fortunate as a student because you are formulating your thought processes as you learn versus changing your habits. One of the changes prior to this time was passing the law requiring all dental practices to be open to patients treating patients with disability. So keep an open mind towards homebound dentistry by Dr. Glenn Goodhart. Really good. That was a nice positive thing there. So
Mhm.
it is true. You're not going to know any different to some degree. So when
Yeah.
HIV was a big thing, dentists didn't wear gloves, and now they wear gloves. That was a big
Mm.
transition. I want to ask if we get student membership of the ACD is useful as a dental student living outside in Pakistan. Look, people are watching us from all over the world, Laura. Look,
Wow.
uh, I think student memberships in CE programs are always valuable to learn what other dentists are using. Just make sure they fit into the budget that you have. And it doesn't mean don't spend any money. Don't be super cheap, because I know people are ordering, Grubhub and caviar and wine, but you don't necessarily need to spend thousands of dollars as a student right now. So ask for student discounts. There's a lot of free and reasonably priced CE. We have different things here on Dental Nachos, but great question. You might have covered this already, Laura, but are the seniors graduating on time, even if they're not done with requirements? Do they have an answer for that?
Yes, I would say like most of them are graduating on time. Um, I'm not quite sure, like they haven't released any numbers or anything of who isn't graduating on time, but because they lowered the requirements so much, I'm assuming they're, because I know that they have a panel right now who is basically reviewing everybody's case. So you send them a portfolio of all the things you've done, maybe pictures of maybe fillings or crowns that you've done. And then the whole panel sits down and they review your case and determine whether or not you're fit to graduate. Um, yeah, so I would say like most people are doing fine, even though they've lost this quarter. I know that Lauren just said in the comments how, yeah, as a fourth year, they're like missing 2 months of clinic time, which really sucks because as a second year, we're doing like half classes, half clinic. So we're still getting the clinic, I mean, we're still getting the classes value, but I would say it really sucks as a person who's graduating who has all clinic and they're literally getting like nothing right now.
I mean, also for the fourth year that said that, and I'm happy to help. I'm really good with words. I'm good at kindly annoying people. If you missed out on 2 months I'm just going to use an example. If you missed out on 2 months of an experience of training, and let's just say that experience is valued at $4,000, and there's no way to recapture that experience, or a refund of $4,000, you could use that on other CE. You could use that
Oh
in
yeah.
a different program. One of my favorite things is CPS, creative problem solving. I know it stinks for the school, but they can't pass all the pain onto the fourth year students. So they may have to share in that and say, hey, we're going to refund everyone $2,500. We're going to give you your degree and go out and take CE this summer. I'm just speculating some ways to creatively solve this problem. And if you don't ask, no one ever answers it. And these are tough conversations to have, but they're worthwhile ones, especially when it's your education, your student loans, and your experience. On the last one, we had two great students on, Lauren. I know you're like a year away, but here's another one. Like if they give all these fourth year temporary licenses, is anyone going to hire them because they're not so sure because they didn't graduate from dental school
Yeah.
yet? It's a
Yeah.
challenge. And I'm a practice owner and we have young associates, new associates, BADs, CADs, but it's hard to say, okay, I'm going to hire someone from dental school Now they have a temporary license. Are they going to get a license? It's just, it's really a challenging scenario that I think dental students have to be very loud about with the licensing boards, their classes, so that they can figure out where they get to this next step.
Yeah. With the licensing boards, I know that like, because our school hasn't taken our boards yet, so we have a lot of unlicensed people running around. And so they're really hoping to get that, because we usually have the patient, you have to do a class 2 on a patient and an SRP with a Cavitron, which are two bad ideas.
It's just so crazy. The things they choose to test on live patient boards are insane. They don't test a root canal, but they do test scaling and root pointing. I did see there was some possibilities of them passing something to make it all on mannequins now for boards.
Oh, yeah.
Which would be great.
They're in the talks for that, yeah.
Which would be great.
It'd be amazing.
Outside of COVID, just from an ethical perspective, that we test
absolutely
on the boards. Now, just to switch gears for a little bit for our last 10 minutes, I think I want to bring up something positive that people can do at home. You are very active on Instagram, not as much on Facebook. Maybe there's gonna be another thing called Snapagram. I always say, never technology shame people, because the cool thing you're doing, I always say, you know, my daughter, who's 18 months old, sent you the video, she'll probably say in 20 years, oh, my dumb dad texts, we just send holograms to each other. You know, so don't technology shame, but share with us, if someone's sitting out there saying, hey, I'd like to be more active on Instagram, I'd like to connect with people. What do you use your Instagram for? Dental, personal? Tell us a little bit about that.
Well, I actually have 3 Instagrams. I have my personal Instagram, I have my dental Instagram, and then I also have a lettering Instagram.
What was the last one?
A lettering. I do like calligraphy. It actually all started off with my calligraphy Instagram.
Oh, cool.
Because I did it as like a hobby thing. So it was like a place to post calligraphy and all that stuff. So I started this when I was like a senior in high school. And but that also got me really into like the whole Instagram thing. Like, you know, rather than just using it for personal use, like most people I would say use Instagram for.
Yeah.
When I got to dental school, and I made these like typodont sculptures out of typodont teeth, like little animals. So I started posting that on Instagram, and that's basically what started my Instagram. Yeah, but I just really enjoy it as a way to, because Instagram is definitely a very, I would say like, it's a very strange relationship that I have with Instagram, because it's such a, like, it's a platform where you can compare yourself to other people so easily. And you're just seeing like, oh, this person's really successful, or this person's doing such fun things, and I'm sitting at home, you know?
I always say, you know, and that's a tale as old as time. And I wish we could, I love Gary Vee, and I follow him on Instagram. I mean, we judge ourselves so harshly against people who are never going to meet us, when we could just say, that's great, they're doing that. And people wait till, you know, people talked about that with posting of these dental cases. And, you know, it's like people tend to post how they look when they get dressed up for a wedding, but usually they're wearing sweatpants. And I think we just need some more authenticity there. But I love your calligraphy part. Are you still doing calligraphy now?
Much, much less, just because dental school got busy, and that dental Instagram is definitely taking over my life. So it's really hard to juggle 2 Instagrams. So I've definitely like put that on the back burner, but it's still something fun that I enjoy doing whenever I have free time, and it's like a relaxing, you know, sort of thing.
And what I want to share about yours, and I know my sister Jill reached out to you, is I have dental Nacho interns who are awesome. And when they, you know, I'm at Dental Nacho's headquarters in my building. We get pizza on Saturdays. They help me with stuff. They're awesome students, but it's amazing to me that some of them don't even have an Instagram, and some of them have 10,000 followers. And I tell the ones who don't have it, start your dental Instagram, because this is going to be a way for you to differentiate yourself when you apply for jobs, when you apply for residencies, and just for people to know you. And what's great about it, it is the favorite price of all dentists and people. It is free, so you can use it. So, I mean, your Dr. Teeth Boutique is your dentist one, and it's a process just like anything else. And it's not a follower contest. I don't think it's about having a follower contest. I think it's having a content-rich Instagram profile where if someone was to go to it, you could showcase your story, and your story could be about how you treat people, what you like, and this combination. I mean, we've had on here Dr. Desiree Yazdan. I don't know if you follow Desiree, but she has like 145,000 Instagram followers. She's a dentist in California.
Oh, Dr. Yazdan, yeah.
Dr. Yazdan, yeah. So she's my buddy, and she's always like, how'd you build this Facebook thing? I'm always like, how'd you build this Instagram thing? And she just constantly started because her practice, she had a problem with her practice. Her partner left. She had to build up from scratch, and she said, "I'm going to use it." And she does it so well. And
Yeah,
story you
absolutely.
can
Yeah.
tell over and over again. And to me, I was saying Dental Nachos, I always post the top shares, and I say it's not a contest, it's a share test. And it kind of sounds dorky, but it's the same thing as Instagram. Make your profile, start doing stories. I love stories. I mean, they tell, they can be funny, they can be fun. So let's say there's another D2 out there who says,
Yeah.
I'm going to start an Instagram, my Instagram profile. I'm inspired by you, Laura and Dr. Nacho. What should they do to get started? Like, what type of content do you think is good just to get people, when you do a crown prep on number 20, we don't make you do number 2 to get started. What's some good content to get started?
I would just post like anything that really, for me, I view my Instagram more of a diary journal sort of thing, just because I always tend to forget like these moments in my life that I thought were like fun and I would want to remember, but sometimes it just slips my mind. So I do like to use it as a way to, like, if I did something really fun in clinic, I write about it. And then I tend to have really, really long captions just because I type a lot. But yeah, so I view it as like a diary thing. So I just post whenever I have something exciting, or if I see something in my life that I felt would maybe other people would enjoy, reading, or just honestly whatever you see and you like seeing, I feel like would be good for you to post. It's just like, if I see a lot of people who are like, I like seeing when people inspire me or motivate me.
Yeah.
So I want to do that for other people as well.
Story. And I was just walking, I sent you that video this morning, walking around with Drew in Philly. It has so much rich history. I love the move, the play Hamilton. My good buddy, Mitch is on here, likes it. Like that's modern day. It's modern day storytelling, but I love your journal part. That's what I do for my family and kids. I believe, Laura, that like this phone, which is out of like space on top of space, I believe all these pictures that I took 14 pictures today. I'm never going to look at them. There's going to be no way for me to go back, but my Instagram will be there. So I can go and look at my stories. I can go and look at my pages. And I would say you don't have to share the best thing that ever happened to you, the worst thing, just share your story. And I think it's a great way to look at it as a modern day journal. So raise your hand if you're on this Zoom call, if you regularly use Instagram daily. And if you don't, start, because I think it's a totally different muscle than Facebook.
Absolutely.
It's a little kinder in certain ways. There isn't as much ability. Facebook for dentistry, there's a lot of value, in my opinion, and that's why I think every dentist should have both. For dentistry is I post a case on Dental Nachos about an implant, and this went not so great, and I would change it. I can get 150 comments, and everyone can talk about that one thing. And I believe that's a strength of Facebook. But there's also a downside because people can get very mean. And on Instagram, it's just a different social media muscle. And I encourage you, if you're a student, to do it, because if I was hiring, I would look at people's Instagram, not to troll them or stalk them. I would just say, oh, let me see their story. And Dr. Yazin's a perfect example. We had Jordan Skylark last week, Abdullah, his dental expressions. And that's how you get to know people before you meet them. And I'm sure that's how you and your friends probably look at people that you meet anytime with Instagram. You look up their Instagram. Is that accurate?
Oh, yeah. Yeah. And you do a little bit of stalking, like.
But no, watch this. You should just call it personal research instead of stalking.
Yeah.
I'm not doing stalking. I'm doing personal research. And then you just get down this rabbit hole, but sometimes it's a fun rabbit hole. Like I'll start reading Desiree's posts, and sometimes I'm like 15 foot down, her husband's beard, all that stuff. And it's cool. I feel like, you know what it is I feel like I know that person. And that's, and what's great about it is you can delete anything you want. You can moderate yourself. So and that's also just cuts both ways. As someone who hires a lot of people and who coaches people, you can always post something. You can't unpost it. So if it's not reflective of what you want people to see, it's not always a good thing to have, especially if you're in a professional world and things like that. So you can text that to your friends. Well, you've been awesome, Laura. I appreciate you being on here with us. I want you to come back again and we'll talk more. We have a couple of great dental student things coming up to share with your friends. We have a technology course tomorrow night, free for students. We have a Save This Tooth or Extract It on Wednesday night. And then next weekend, we have an awesome festival. So we'll share that with you. Any parting words for our Dental Nachos audience? Anything you want to share about being a dental student, calligraphy, nachos?
I don't think so, but thanks so much for having me. This is so much fun.
Oh yeah, it was really fun to talk with you. Dental Nachos crew, dentalnachos.com. You get a prize for watching in here in the Zoom chat. Make sure we get Laura that prize. And now we're Zoom and Instagram friends, Laura.
Yay.
Awesome, guys. We'll jump off the live stream. We'll stay on Zoom here for a second. Man, I'm going to take us